Thank you for being here, Shaun. Shaun is the manager of radiation services at New York Oncology Hematology. He is the president-elect of the Radiation Therapy Association of New York State and has over 15 years of experience in radiation oncology, notably at Sloan Kettering and Roswell Park. Shaun has extensive experience working with 3D printed bolus, both in his current and previous positions. So today he will be providing the perspective of an administrator when adopting new technologies such as 3D bolus. And with that, I'll hand it over to you, Shaun.
Great. Thank you, Erin, so much for having me here. I really appreciate the opportunity, and I want to talk a little bit about my experience in the adoption of a 3D printed bolus program at my organization. As Erin kind of went into, I do have quite a bit of experience in the field, starting if you want to include schooling back in 2008. And then I kind of climbed the ladder a little bit, started off as a staff therapist at Sloan Kettering, became the senior therapist, eventually supervisor before I transitioned into more of an admin kind of role. And I'm now at New York Oncology Hematology in the capital region of New York State. So what I'd like to do today is do a little bit of background of just traditional bolus and what options are out there today, and the reasons why I've adopted the 3D printed bolus. So a lot of us will know and realize that the purpose of bolus is to bring the dose closer to the surface, more superficial dose. And that's important for a variety of reasons. Sometimes there's irregular shaped tissue. There's sometimes that things aren't even, and if now there's different depths, it's going to change how the dose is realized in that patient. Historically, we've used a number of different methods, and this is not completely comprehensive, but what you see the most is the superflab kind of. I tell patients it's like a rubbery piece of a rectangle. It starts out originally, which is tissue equivalent of a person, as well as wet gauze we still see clinically, and then maybe a little bit older, some of us older generations would have used rice. One of the major drawbacks of especially superflab is that because of the irregularity, the reason you might need bolus is it's very difficult to get that bolus completely flush at all times. As you see here in this photograph, there's just a hand, and you can imagine, because of the intricacies of anatomy, that getting that bolus completely flush without anything approaching an air gap is very challenging. Us therapists see that all the time. And according to the Journal of Medical Physics, there could be a significant difference in planned dose to actualized dose in that patient. Depending on the field size, of course, there could be anything from 0.7% all the way to almost 15% difference of the desired surface dose. And then when we speak about Dmax, which, as a reminder, is, you can basically think of it as the prescribed dose or maximum dose, depending on the depth and energy. Dmax could also be affected, and especially if the field size is small, if the bolus is on the thicker end, and the bigger the air gap, the more the Dmax is affected. So these concerns will lead to differences in the planned dose, which is what we want to avoid. And so the question becomes, okay, well, can we make some sort of a generic bolus that I can reuse? For example, here you see a bunch of different ear shapes, and it's pretty plain to see that one size does not fit all. If we were to make a general ear bolus that we wanted to use for all of our ear patients, it's not going to fit the same way. And that's the same for a lot of the anatomical sites that we are really interested in an extremely custom bolus. And we're talking ears, breast, nose, scalp. Those are the four that in my clinic we see the most that have the most difficult time trying to get rid of any air gap. In addition to that, as a lot of us know, there are probably surgical scars, or at times there's fungating tumors that really cause these almost impossible anatomic landscapes to create zero air gaps. And so now enters the idea of 3D printed bolus. The way I like to describe it is, one huge revolution in the world of radiation therapy was when IMRT came about, and that is a dose painting approach that is completely unique to that patient's anatomy. So not every person is going to have the exact same anatomy, so the IMRT can be customized to fit just that person, no one else. So why can't we do the same thing with beam modifiers? As you see here in the photograph, on the left-hand side, you see a patient being treated to the breast. And if you're a therapist, you have tried in your past to, with a rectangle piece of superflab, try to contour it to a breast, and it's almost impossible without wrinkles, without air gaps, just because of the nature of the shape. And so what a 3D printed bolus is going to be able to do for you is to customize and get rid of those air gaps. And here I have an example that will be a little bit hard to see maybe on camera, but this is an ear. And we'll have some more photographs in a moment too. But this is going to fill in every air space for that particular person. One thing that we're going to be discussing in detail is how having this product will become a market differentiator for your competition in the area. But more importantly than that, it will give you better clinical outcomes. It'll give you more predictable outcomes. You're taking some of the questions of what happens daily with an air gap of varying sizes, depending on the setup. You're going to get more accurate and better clinical outcomes with this product. So now that we kind of are on the same page of the benefits of a 3D printed bolus, which are fairly apparent, the question becomes, okay, how do we bring that service online logistically? And so for myself, if I'm going to talk a little bit personally, when I was working at a large institute, namely Sloan Kettering, we had the funds and the ability to purchase a number of 3D printers. And we're talking on the order of 6 to 12. It could be higher by now. And the reason that you can't just buy one is because the capabilities of each product, of each printer, are quite different. How large the bolus will be will depend on which printer you purchase. What that bolus is made out of will be different depending on what you purchase. In addition to that, you need to these are fairly large pieces of hardware. You need to be able to store it. You need people to become experts in using that piece of equipment. They, could be costly. There's an overhead associated with buying the printer. So when I was at Sloan Kettering, we had those things, and we were using 3D printed bolus quite regularly. And so I saw the benefit firsthand of using them. And we'll go into the benefits a little bit more, but I was basically, I was sold on the product. I knew that it was a thing that was worthy of investment. And then when I became an administrator at a different company that's not the same size and who is as Sloan Kettering, the question becomes, okay, maybe I don't have all the resources of one of the largest cancer hospitals in the entire world, but I know that this product works. And so purchasing just one printer The issue with that is now you have just kind of handcuffed yourself to a certain type of material or certain capabilities, and new printers come out all the time, and now you no longer have access to whatever new features there are. And conversely, you know, I can't go out and purchase 6 to 10 printers, so I have all the options on the table. And so using a third party such as Adaptive to take on that overhead cost, to be able to print whatever type of bolus you want, it really becomes very useful. Pictured here, you'll see a patient who had a scalp bolus. The reason I put that on this slide is if you think about it, rigidity in the bolus does matter. If this was made out of just straight superflab type material, when a person has to lay on that bolus, it's going to change the thickness of the bolus. Just the weight of this person's head is going to compress the bolus, and now you no longer have a bolus that you can be confident is the same thickness all around. So you might want to opt for a more rigid type of material. So you might not have, if you only own one printer, you're going to be limited to what kind of boluses you can create. In practice, some of the things that are important when making this decision is if you're a physician, you're explaining to a patient about a course of radiation to your ear or nose, and you're able to tell them confidently that we're going to create this piece of material that only will fit you. It's not going to fit the next person that I need to treat with a similar disease. This is something that is specialized and individualized just to you. As a patient, that gives you confidence. That gives you an understanding of how important and how meticulous this radiation plan is. In my experience in using Adaptive, the turnaround time is quite fast and reliable. We've never had an issue with receiving the bolus in the anticipated amount of time. Everything is completely PHI safe. Everything is randomized for transfer when we have to give the DICOM images to Adaptive. There is no concern about that patient's information being out there and being vulnerable. And lastly, again, as a therapist, Adaptive is certified as compatible with Vision RT. Any of my therapists out there will know that if you've ever used certain SGRT products with Superflab, that the Superflab will reflect the infrared SGRT tracking system and give issues. So then you have to start using workarounds such as putting a pillowcase over the Superflab. Those are issues that you have with traditional bolus that Adaptive has thought of. So again, if you're an administrator, all right, you decide that this product is worthy of investment. You decide that I'm going to allow Adaptive to keep all of the overhead costs, and I want to keep all my options open and be able to print any size, any material that is offered on the market currently. Now I need to get buy-in from my colleagues. You really need to adjust your selling point depending on who you're speaking with. 3D bolus is individualized, and so your sales pitch should be individualized depending on who you're speaking to. So you have to know what each shareholder is concerned about. And for the physician, that might be the patient outcome, right? They want to make sure that the patient gets the best treatment available. You can grow the practice. You can, market that this is a product that you have. As I mentioned before, this is a market differentiator. And they'll see, that there will be improved skin reaction, which we see every day. If you're speaking to a physicist, that you might want to talk about how your dose distribution is going to be even now because you don't have those air gaps that no matter how much tape a therapist use are still going to be there for certain shapes with traditional bolus. And then kind of hand in hand with that, if you're speaking to the therapist, you're not going to spend 5 to 10 minutes trying to get the bolus as perfect as possible because it's already going to fit like a glove. So placement of the bolus is much easier. You're not going to use, 3 rolls of tape every day. It's just a much easier product to use in practice. And then the executive team. So, you have to get approval to have this partnership with Adaptive implemented because you still need to purchase these boluses. So then I would rely heavily on the fact that this is a service that not every organization has implemented yet. It's still emerging. And so what this could do is open new referral pathways. It can, if you market it appropriately or if you do some outreach, other referring physicians, they're going to take that into account. They're going to want to hear, hey, we've further individualized our care. And this is something that we can offer that maybe not everyone else can right now. A little bit of a glimpse into operationalizing this product. We use in my organization ARIA as our EMR system. And I just took a quick screenshot just so you can kind of understand the order of operations here. So using CarePath, which is basically streamlining a workflow. What we do is we start the same way after any simulation, which is dosimetry will import the scan, and then we'll have the doctor, depending on the site, there may be regions of interest that the doctor wants to contour. There might not be. After that, the dosimetrist will create the 3D bolus in Eclipse, and then they'll take that information and they'll upload it to Adaptive. And then there's a turnaround time where the Adaptive creates that bolus. And then we have the dosimetrist, once it arrives, they receive it, they validate it, just making sure all of the patient information lines up. And then we have the scheduler call the patient because we'll want a separate planning scan with the bolus to happen next. So there really are two different scans that will need to occur. And then as an administrator, you're always thinking about reimbursement as well. And so just a couple of examples of how we've been able to change our reimbursement model for these types of patients because of the complexity, because of the extra drawing of the bolus, the extra scan. We can, again, allowing that there is proper documentation, but we can charge for a special physics consult as well as a special treatment consult. If the patient is receiving IMRT, then all of these SIM charges are bundled together. But if it's a 3D plan, we can charge for the initial SIM that we use to draw the bolus, as well as the planning SIM when they come back and have the bolus on that we're going to be doing the treatment plan off of. In addition to that, the bolus itself is highly customized and individualized, and we can charge the 77334, which is the higher device charge, because this cannot be reused. This is something that's only for a one-time use. And so these charges, depending on what kind of bolus, the pricing for the bolus will change depending on size, depending on material. But there are all of these charges that will go to offset some of those costs for the bolus itself. And so in conclusion, I would recommend any site to try this at least once or twice, try a trial program, because your physicians are going to see the improved skin toxicities. They're going to see that in real time. So I would recommend any organization to do kind of a trial run. The workflow itself was pretty simple. As you saw, we created a unique care path just because I'm a big fan of making all of your workflows electronic. And then once you adopt the service, then it's time to do some marketing. Let dermatologists know in the area, let head and neck surgeons know, breast surgeons. They need to know that their patients will be getting better care at your facility. And ultimately that's what we're here for, right? We're here for a better outcome. And I believe that this product does just that. So thank you very much. That's all I had for today.
Well, thank you so much, Shaun. That was really great. I'm sure we have a couple of questions for you if you have time.
Sure.
Tom or Gosha, do you have any questions?
I do have.
Yeah, I do.
questions.
Shaun, speaking of your patients, do you have any specific patients that may have made some comments in terms of the comfort of the bolus that you've ordered from Adaptive, or any outcomes from those patients after they've been treated? Any comments from them would be very interesting to know.
Yeah, absolutely. So just looking at this photo here, like an ear, they'll patients can tell you right away, oh, that doesn't feel quite right because of how precise that these and intricate these boluses are. They're going to know exactly if there's a small rotation that needs to occur, and they'll tell you because it's going to not feel the same. If we were using, on the other hand, just a piece of superflab that we tape over it, they're going to have no idea if it's not the same as it was yesterday or before. So we do get that. We do get the, hey, this kind of feels a little funny, and that's they're the ones with the bolus on. They're gonna know if it's different when it's that customized. So I think it's helpful when to the therapist when setting the patient up that the patient will know right away, like, oh, that doesn't feel quite right.
It is great
Thank you.
that patients, as you mentioned, understand the value of custom treatment, and all this feedback they provide is very helpful. But I'm wondering if maybe you can quickly comment on and describe maybe the process that you followed to implement the TrueFlex silicone bolus usage in your clinic.
Yeah, sure. So what we did first is we did a lot of research. Some of our staff, myself included, had experience with the 3D bolus, so we were bought in. But with some of the other staff, as I kind of mentioned before, you have to tailor your conversation to them based on what is their primary interest. Again, something like a physicist wants to know that the dose distribution is better. And so I think that getting buy-in, and it's not a general buy-in, it's an individual buy-in for all of these different shareholders, is really, really important. And then once you trial the program, that's what we did. We piloted it at one particular of our 3 sites. And the doctor gets their hands on, they have a few of these courses under their belt. They're seeing these patients in their weekly on treatment visits, and they're monitoring the skin reaction, and they're seeing in real time, oh wow, this reaction is not as severe as I'm used to, or the patient's, it's a more comfortable fitting for the patient. I think that you really need to have a couple of courses under your belt to have that full buy-in, especially from the physician side. So I would recommend at least a pilot program. Just see if this is something that your doctors are going to put a lot of weight into.
Thank you.
Shaun, I really liked your idea of having specific I guess, buy-in sort of aspects that you need to discuss with different people, because everybody touches 3D bullets in a different way, and so that messaging is different. And my question is actually for this line about dermatologists and surgeons. Sometimes, as we know, those referral patterns can be very strongly ingrained, and so I was wondering if you could speak a bit on what kind of tactics you've used to sort of impact or alter those dermatologists and surgical, referrals.
Yeah, Aaron, you're exactly right. Some doctors are very set in their ways. They've been referring to one of their colleagues for years, and it's hard to kind of break that chain. I approached that the same way that I was approaching the pilot system, in so much as, here are the benefits, create some sort of quick sales pitch of maybe photos, such as that breast photo where you see the air gaps. Here's why we know it's better. And if you just send 1 or 2 patients to us, I can guarantee you the feedback you're going to get from them is going to make you insist on this product. You got to get your foot in the door some way. So if you can get them, just hit them with some of the early the facts of why this is a better product, and then just ask them, hey, if you just give me a chance here, send me 1 or 2 patients, I will show you why those patients will get better care with us and this product than they will somewhere else. And seeing is believing for them. They have to get that feedback from their patients, and they know, all these referring doctors are adjacent to the field of radiation oncology. They know what to expect in terms of toxicities and side effects that their patients undergo. And when you can prove to them that we can lessen some of those side effects, most doctors, you have to believe, are interested in outcome over anything else. And if you can prove that, you're going to see some more referrals from people that maybe you weren't getting referrals from originally.
And would that message be coming from you, or would it be coming from a radiation oncologist, or how would that work?
Yeah, it depends on your organization. It depends on your radiation oncologist. I can tell you that me as an administrator and a therapist, namely not a physician, it's some doctors only want to hear from other doctors, if we're being honest. Others are more open to speaking to an administrator, or at least having that be the way you get your foot in the door. But I think if your radiation oncologist is comfortable and is a good salesperson, the most effective way, if we're being honest, is the radiation oncologist speaking directly to other physicians. But in lieu of that, the majority of practices will speak to the administrator, will speak to, if you have like a business marketing department, they'll speak to them as well. But I think the most effective is often the radiation oncologist.
Great.